My name is Adele. I'm actually a medical officer working in Kapit Hospital. Currently, I'm doing my attachment in Kapit Hospital Psychiatry Department, one of the medical officer there now. Yeah.
So my name's Rozy. I've been a counsellor for close to 6 years now. Been practicing. So I completed my master's in counselling. And ever since then, I've been seeing different kinds of people, from kids to adults. I also did teaching children on the spectrum as well. I was also doing my practicum in Awam, so I've seen like a lot of abuse cases, stuff like that. So I think in terms of people that I've seen, it's quite a variety lah.
My name is Charlize. I'm 19 years old. I'm from Sabah. I'm a foundation in TESOL student at UiTM Dunkil. I'm also an active volunteer at Youth Listener, which is an organization that provides free emotional support, and I'm a strong advocate for mental health.
So my first question will be, what are the different types of mental health professionals?
Alright. When we talk about mental health professionals, the teams include doctors, can be the medical officers, the psychiatrists, and we have medical assistants, nurses, psychologists, counselors, and occupational therapists involved in the mental health teams.
I see. Okay, so how would you normally treat a patient with depression?
Alright. Depression can be treated using oral medications. We call it antidepressants, and various psychological therapy also can be used to treat a patient with depression.
Okay, so what are the most common causes of patients' admission to the psychiatric ward these days?
We have the most common is a patient with schizophrenia, the one who is having relapse, and then new cases like substance-induced psychosis are the most common nowadays.
I see. So, what is the nature of mental illness from a medical point of view?
Mental illness is a treatable illness. It affects the way you think, your mood, and function, and it requires a good history taking with a mental stat examination in order for you to diagnose a person with a mental illness.
Okay, so will patients diagnosed with mental health issues need to continue taking their medication forever?
It depends on the type of the mental illness. Schizophrenia patients are required to have long-term treatment. Means they need to take their medications for lifelong. Yeah.
Okay, so what is the biological effect of the patient's medication, and what do you expect it to accomplish?
Right. The current medication that we use, it actually helped mainly, it affect mainly the brain function that can help to regulate the chemicals, hormone, and it does require careful consultation with the patient in order for us to decide lah. And most importantly, it is used to reduce or relieve the symptoms they're having.
My last question will be, what are the effects of leaving mental health issues untreated?
Okay. It will lead to a person to have a social impairment, and his or her pre-morbid function will decline. Means if a person have a mental health problems, if you don't treat them, slowly they will lose their function. Means, for example, if they work as a teacher, and then if she has a mental illness, we don't treat them, slowly they can't work anymore, which will affect their life. Affect the life after that.
one see a psychiatrist or a psychologist first if they want to get?
I think the sequence don't really matter for as long as you see both. Yeah, for as long as while you're taking the medication, you're also working on yourself through the therapy sessions. And likewise, while you're going through therapy, you need to make sure that you're stable enough. So that's where the medications come in. Yeah.
That's understandable. What
Yeah.
are the different types of mental health problems? How would you get a client to open up?
That. I think it's different for different people, but generally it's really about, firstly, I think curiosity is very important, and withholding your judgment. So if you're going to see a client and you already have a prejudgment of them, that's not going to build that rapport with them. I think the most important thing for you to have as a therapist is to build that rapport with your client, to have a non-judgmental behavior, and to also have empathy, because without all that, you are not going to have that connection with your client. Client's not going to open up. And I think more importantly is your client needs to trust you before they can open up. And for different client, it's different, and you need to be able to be in their world to understand how things are in their world for them to open up to you. So if your client says that the apple is blue, you are not in a position to argue with that. You are in a position to be curious about why the apple is blue, and then try to understand in this person's world, what does the apple mean to them, and why is it blue. I think it's true that you're able to build better connection with your client and build that rapport. And I think through that, when your client can see that you do believe that the apple is blue, I think then your client will open up to you.
Have you ever come across people with treatment-resistant depression, and how do you cope with it?
Oh yes, I've had someone who came in because the partner made her come to the session. So she was very resistant. She wouldn't talk. And but surprisingly, she's one of the longer clients that I've had. We've had many sessions. Yeah. So of course, when she came in, she was very hesitant. She was very reserved. She wasn't opening up, And I think there were a few sessions that were just there in silence. And I would tell her that I feel really bad that you're paying me for you to sit here and we're not doing anything. So I did ask her, is there anything you would like to do during our session? It doesn't have to be therapy, but we better make use of the time and money that you've spent now. So I've asked her, is there anything you want to do? We can play games, board games if you want. In a way, that's also me trying to connect. It's me trying to build that rapport with her in a very indirect manner. I would also throw questions like other things that is not so therapy-like. Things like, what do you actually do? What do you enjoy doing in the past? Is there something that you like doing? So she was into art and literature. So we talked a little bit more about that. And I think it helps that I was also doing a lot of narrative therapy. So those things are metaphors to me, right? So we dive more into the literature, dive more into the arts, and I would then ask her questions like, what does that mean to you? How is this important to you? Does this reflect your identity? And things like that. You see? So that's how the therapy gets going. So although it's just normal casual conversations, things that she likes, but it is also very, I would say it's purposeful. Yeah.
What do you think individuals who are suffering from depression can do to reduce their challenges?
I would say baby steps, really. Really, just baby steps. For me, when it comes to depression, I've always told my clients, it's because you have felt so much, because it's been too overwhelming for you that you feel that you need to take this break. It's like a rubber band, like it's been stretched for a while already, and then one day it just like it goes back. Yeah, so I think when it comes to depression, it's often because a lot of things have happened, you've been overwhelmed by a lot of things, and then one day you just feel numb,
True.
and so I would say that if you need to take a break, do take a break. If you feel like you don't want to function right now, you don't have to. So my place is not to force them to do something that they don't want to, but we'll start with little small steps, like let's have a shower, for example, or let's do something that you used to like, for example, just little, very, very little steps. Yeah.
Okay, thank you.
No
What
worries.
is the connection between one's mental state and their self-esteem? How do these affect one another?
Mental state and self-esteem. I would think that someone with a mental disorder would also feel not too good about themselves, right? But it's also a chicken and egg thing. Which one comes first? Is it the low self-esteem first, or is it the mental disorder first? Like people with body image problems, for example, they already feel low about themselves, right? It's a very chicken and egg thing. I think there's a bit of overlapping there as well, and oftentimes when it comes to self-perception, that affects your self-esteem. Those with clinical disorders where they're very low on functioning and they need someone to look after them, I can imagine that their self-esteem is also affected because you're dependent on someone else, you're burdened on someone else, and often they carry that guilt. Yeah, so it's a lot of variables that we need to take into account here when it comes to someone with a mental disorder as well as their self-esteem. A lot of variables. Yeah.
Can you
Yeah.
tell us about affordable mental health services for the financially needy, such as those from V40 households?
Yeah. So unfortunately for private centers, as you're well aware, we're all aware, it can be quite pricey, but there are therapies that do pro bono. Yeah, so there are therapists who do pro bono for those who don't have the financial means. But other than that, there are also NGOs like Awam. There are also NGOs like WCC in Penang. There are many NGOs that do have counseling centers that people can make full use of. Yeah, actually, I don't have I don't have it right in my mind right now, but there's a list that you can refer to for those who want to seek counseling. But I would also think that you need to be mindful of who you see because not all are I don't know, like I would say that because the field itself is not as developed as other more developed countries, I would think that the standard of quality isn't being monitored. So I think it's very important that you select your therapist carefully, because you can have a bad experience from it, and we don't want that. We don't want bad experiences for people while they're trying to be vulnerable. Yeah.
That's true.
Okay.
The pandemic, affecting everyone as how it has, was there any significant effects on your mental health, or was it just, shall we say, the same, or did it worsen, or maybe it helped a bit?
Well, overally, it has affected my mental health horribly. So first of all, during the first lockdown, back then when I stayed at my old house, because now I'm staying at my aunt's house, I was in a place where I was always just confined to the same environment, which was the main cause for my mental health decline, actually. So, being suffocated in the place where I was abused, it really impacted my overall well-being for me, because it leaves me stuck with my own thoughts, which are often very self-destructive. And personally, what really helped me survive throughout those years of having undetected mental illness was talking to my friends in school. And I've graduated during the time it was the lockdown had already started, but I wasn't able to meet my friends face to face. And even though I could speak to them, through a screen, it was just not the same. So I'd say that the pandemic has really affected my mental health badly, and it has also happened to other people. Yeah.
Okay, so thank you for the answer. Moving on, what is your experience with treatment for your mental health?
Experience with treatment is that I'm currently taking cognitive behavioral therapy, otherwise known as CBT. I'm on medication, and I'm also trying out acupuncture. So I've always been afraid of taking medication, but I've started it in 2020. According to my doctor, the purpose of medication is to stabilize the chemical imbalance in my brain, which is contributing to my mental health problems, and also to catalyze the process of recovery. And it is also accompanied with therapy. I've tried many types of medication, including antidepressants, and I've experienced painful and tiring side effects, but that was only because my body was getting used to it. So as of now, it's okay. And as for CBT, the therapy, it's a practical approach in rationalizing unrealistic and negative thoughts, or if you put it in psychological terms, called cognitive distortions. It's really helpful in bringing awareness for specific and common negative thoughts in my mind, and to correct those logical errors. And for example, I would say I'm a burden. So how do I correct that statement, to not exactly to deny the fact that, yeah, my family is spending money on me, but that doesn't mean that I'm a burden. Maybe I could say the financial need is necessary, and it is for the best for my recovery, that kind of thing. And as for acupuncture, this might confuse people, but actually a research suggests that it can reduce the severity of Tourette syndrome, since that's what I'm diagnosed with. So yeah, that's my treatments as of now.
It's very interesting because I didn't actually know acupuncture could do that.
Yeah.
That is why people need to know all of this.
Yes, indeed.
So you mentioned also just now how would your family and friends would be able to help you, right? So as someone who has been a silent supporter all this time, I would like to know as well, how are we able to help in maybe certain situations, maybe emergencies? Do you have do's and don'ts of what to do, what not to do, and especially what to avoid?
Yes. So I'll start with the do's. So I think the main thing that people should do for those who are struggling mentally is give unconditional love and support. And I'm going to emphasize on unconditional here because, we unintentionally, we set these sort of labels or expectations for people. We want them to be a certain way, as if it's for their own good. But, as for people who have depression and anxiety, it's not helpful for us to be burdened by these sort of expectations. So I'll get to more of that on the don'ts. So as of now, what friends and family can do is to first listen. By listen, meaning really listen, without cutting us off. And then once you listen to us, maybe you can comfort us and comfort us with gentleness, and to just not say anything judgmental that's off limits. Yeah. And I think the third one is really important, is to accept us for who we are as of now. Don't judge us or try to expect us to change or be okay right away, even after you comfort us, because it takes time, And another thing is that you can do is to encourage us, saying words like, "You can do it, I believe in you," kind of thing, And last but not least, I would suggest and really advise people to do your research on what we're going through. Like, say we're going through a panic attack or an anxiety attack. Maybe you can search on how to help someone with a panic attack or an anxiety attack. Or better yet, you can ask an actual doctor. Maybe call up a psychiatrist or a psychologist to ask. Yeah. So I'll get to the don'ts. So first of all, don't make assumptions. Don't say things like, oh, you're just lazy. Oh, you just don't care. You're just being selfish. Because mental illness is very undetectable most of the time. So it's very easy for people to assume something else. And another thing that a lot of people do, especially the older generation, is to use religion against mental health, saying things like, you don't pray enough, you don't believe in God, that's why you're like this, or you're not, your spiritual health is bad, that's why your mental health is bad too. Well, although it is important for us to balance spiritual well-being and mental well-being in order to be healthy, having bad spiritual health doesn't mean that it's the main cause for our mental health decline. So don't say those kind of things. And I quote like a priest, and he's also a psychologist who has a PhD in psychology. He said, you can't put a spiritual bandage over a psychological wound. So thirdly, don't give us unsolicited advice. Sometimes all we want is for someone to listen. Another thing is, don't tell us to think positive all the time, because that's toxic positivity. Sometimes we just need to feel sad every now and then, right? Because we're humans, we have emotions. And last but not least, it's not helpful that some people pressure and rush us to recover fast, because it increases our anxiety levels. We, as someone who is mentally struggling, I'm also trying to tell myself that, it's okay to go at my own pace. So it'll be really helpful if people remind us that too. Yeah.
So seeing as how the stigma does still exist, why do you think it's still there? Like, is it maybe our attitude, or is it maybe just the general lack of knowledge overall? What's your opinion?
Well, I agree with the latter. Yeah. First of all, I would say the lack of exposure. So sometimes you don't really understand something, a problem, until your own relative goes through it or your own family member goes through it. That's what happened to my auntie. She never knew about these mental health issues until she met someone like me, or she had this nephew who had depression. So it's the exposure that enlightened her, and I think that happens to a lot of people as well. And secondly, it's definitely the lack of awareness. I don't think that people talk about mental health enough at home, and especially in school. We have this subject called PJK, right? And yes, they did talk about a little bit about mental health, but that's the thing. It's only a little bit. I do think that they need to put more emphasis on it, because there needs to be some sort of balance between all aspects of our health. And another thing is the lack of education. Some people don't bother to do research. They just assume things. They assume that they know everything, especially when they don't, even when they themselves are not the ones who are feeling depressed, who are having anxiety. And another, the last but not least, I think a huge problem is that there is this sort of generation gap. Obviously, it's harder to connect to someone. Sometimes it's harder to connect to someone older than you, or way younger than you, to make them understand something that you believe in. How it's harder for older people to understand that you can't pray the mental illness away. And I think that stems a lot from the upbringing of those generations. Like, oh, the younger generations, Gen Z, we've been brought up this way. We've been exposed to this more. We educated ourselves more on this. Whereas maybe, the older generation, of course, they maybe weren't as educated about mental health, or the studies have not enough studies have been made about it, so they couldn't really learn about it. Yeah, that's what I think about why Malaysians still have problems with accepting mental health.
It is always important to seek expert help early, and most importantly, we have to reduce the stigma among mentally ill patients, because it really helps to, our society have very, they are not aware about the mental health, and then cannot help the mental health patient as well. Yeah.
I would say that everyone needs it. I would say that people should be more open to the idea of seeing a counselor. I think it's very important that we also instill these concepts into school education. I think these are things that people should, start having a conversation. Just start having a conversation. Just talk about mental health. Just start talking about, how are you? Instead of asking, Malaysians like to ask, dah makan? Instead of asking that, I think we should make it a habit to ask, how are you? How have you been feeling? And I think this can also be instilled among parents, because parents often ask, how's school? How's your homework? How are your grades? I think we can start with, how are you feeling? How have you been feeling lately? Are you okay? Do you want to talk to me about anything? So just, having that first conversation is very important. And I think the idea of going for counseling, I think that we should normalize that. We should normalize mental disorder. We should normalize all that. We should normalize depression. I think the moment that people feel that it's okay to have whatever they have, or to feel whatever they feel, that in itself is already therapeutic. That in itself will make people feel better already. Just having that acceptance from society, and that would make, I think, mental health as something that is, I would say, it's not stigmatized here in Malaysia. Yeah.
If you're watching this right now, I want to say I'm proud of you for even having the thought of wanting to seek professional help, or the thought of just living your life no matter how miserable it seems. And not a lot of people see that, or no one sees that. Your struggles are valid, your feelings matter, and at the end of the day, we are all human. We have emotions, and having mental health problems doesn't make you any less human. In fact, all the more it makes you a real person. And when you have a problem, what do? You solve it, right? When you are physically sick, you go to a doctor who can handle physical sickness. When you are mentally sick, who do you go to? You go to a psychologist, you go to a psychiatrist. It's logic, it's common sense, and it is important. You are important. So I hope that wherever you are and whatever you're going through, one day you'll have the courage to finally step up for yourself, because in the long run, it's going to be worth it. There will be ups and downs, no matter how hard you try to take care of yourself, how hard you try to fight back those stigmas. But this is a battle that we can fight together. You are not alone, and mental health matters. So yeah, stay determined.